Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. So here we go. This is a male, has a severe allergy to corn. Do the docs know of a treatment for osteoporosis that's not corn-based? Have you heard that corn-based osteoporosis treatment?
Well, I haven't heard of any that were corn-based, to tell you the truth.
Yeah, I didn't know that they were.
I think most of the medications that we give are not corn-based.
Fosamax corn-based?
I don't think so.
Well,
Prolia?
Yeah,
no.
Prolia. Don't think Prolia is.
Vitamin D?
Yeah, I prescribe vitamin D, sometimes calcium supplements, but mostly just vitamin D and exercise. I've really not been quick to use the Fosamax and those meds.
And when I think that if you don't actually have osteoporosis or a fracture that you didn't deserve, you probably shouldn't. I think it's overdone.
Yeah, I think it's overdone. 64-year-old woman, right hip aches at night, not during activity. Also, on occasion, have a pulsing pain down the front of the right leg while laying down. What could be causing the pulsating pain and the right hip pain? That's very interesting. Right hip aches at night, not during activity. Do you have any idea? I wish I had the orthopedist from last week on.
Yeah, I think that person probably needs a brief examination.
Yeah, needs to go. You know that I think that it's sort of like a ligamentous or a meniscal thing. Sometimes it's worse laying down. I don't have a good answer. Do you?
No, not yet.
We'll find it.
We'll get her on examination.
71-year-old woman cannot be in the sun for more than 10 minutes. Will start burning skin after a while. Will develop severe headaches, nausea, fever. It's been going on for 25 years. Had chemo in '86. Does he have anything to do with the sun?
I hope you know the answer to this.
Well, I'm thinking lupus. You know, I worry about solar sensitivity and hypersensitivity. It may not be any of that. I mean, there's also porphyria kind of things.
Yeah, but that's not I mean, that would be more chronic. She would have that even if she wasn't out in the sun on a chronic basis.
Yeah,
so
no.
You may be right. It could be a
lupus. Go to your doctor and throw that question at her or him and see what they say. 57-year-old diagnosed with pulmonary hypertension recently, referred to cardiologist for follow-up. Appointment is 5 weeks out. What can be done for symptoms of exhaustion until seen by a cardiologist?
Yeah, this problem, pulmonary hypertension, assuming this is primary pulmonary hypertension as opposed to some secondary problem due to cardiac valvular disease or something, used to be a really serious therapeutic problem. It has now become much easier to treat, several different agents that are useful, but I don't think there's anything that she can do, or he. I assume it's probably
That's a she.
I don't think there's anything that she can do until she sees a cardiologist, but I do think that 5 weeks out for an appointment if you're symptomatic is probably too long.
Yeah, push your doctor to get you to the cardiologist sooner. Or, and I don't know if getting started on sildenafil 20 milligrams once or twice a day is something that your primary care could do. I don't
I don't have enough experience, I would say, for myself.
Sildenafil is Viagra. And what they're doing is there's a generic Viagra called sildenafil, and they can bring it to you at 20 milligrams dose. Personally, I'm using generic sildenafil 20 milligrams. It's been used for pulmonary hypertension for guys who are looking for erectile dysfunction, you know, because it's a cheaper option. But pulmonary hypertension, sildenafil, you know, and ask your primary doctor to help you or get you in sooner, I think.
Yeah.
71-year-old woman from Watertown wondering, there are any effective treatments for osteoporosis? We just talked about it.
Several effective treatments.
Yeah, but exercise is the most important. 76-year-old woman with Yankton would like to know what the docs think of people over the age of 75 taking cholesterol-lowering medicine, or do they have an age at which they should quit taking cholesterol-lowering medicine? We may disagree on this one.
If If there's a good reason to take it and your life expectancy is more than 2 or 3 years, there has been shown to be a reduction in cardiac and cerebral vascular endpoints if you take lipid-lowering therapy. I think I might say the new 75 could be the old 55 in a way. If somebody had a serious problem, either with risk factors or previous vascular disease, I wouldn't hesitate to give it to them, at least to see whether they tolerated it okay. Are you going to argue with me?
I am. Because as you get older, the side effects certainly go up on the lipid-lowering drugs. And my comment is those numbers have been greatly expanded by the people selling the drugs.
Oh, that's for sure.
I think the difference, if you haven't had an event, it's like...
You're not 75 yet. That's your
problem. When I get to But if you've had a heart attack or you've had a stroke, okay, maybe. But you have to treat 28 people before one has benefited.
Yeah.
And the risks are significant. Memory loss being one of them.
Yeah.
So get exercising. Get out of your couch. That's way more important.
Well,
a glass of wine probably is way more important.
Yes.
Unless you have an alcohol problem.
Yes.
You agree?
I agree, but you could do both of those things.
Yes, you could. All right. 71-year-old female from Platte would like some information on the sciatic nerve disorders associated with it. Has been to docs and chiropractors and PT, and it still gives her pain in the upper buttocks down the lower leg.
If it's really a sciatic problem, which generally means that you have a compression of the sciatic problem, there are very few things that you can do outside of the body to make it go away. If indeed you can prove that you have a compression neuropathy, either it goes away with time or you have to remove the compression in some way.
Yeah. That's a tough one because back pain, surgery to take away pain doesn't always work, but it sometimes does. And like 80% of people who've had back pain who have surgery will get relief. 80% of people who don't have surgery will get relief, but sometimes...
And I think that the cue is, if what you have is back pain, then Dr. Holmes is exactly right. You don't do surgery for back pain if you can avoid it. If you actually have radicular pain or sciatica, your chances of it getting better are much greater than if your primary problem is in your back.
And if you start to lose function in that leg, your foot's dropping or you're losing muscle strength,
yes,
then you need to have surgery. I mean, those are times when you really do move on that, right?
Yep.
You agree? 64-year-old male from Huron, severe case of lymphedema with a lot of discharge, is morbid obese, lots of itching and burning. Personal doc tells him to lose weight. He knows he should, but in the meantime, do docs know any ways to relieve the pain and burning?
Well, you could have a complication of the lymphedema if you have cellulitis. You may need antibiotic treatment. Compression is not as effective for lymphedema as it is for the edema that we get from just retaining
But
fluids.
I think this isn't lymphedema because he's got drainage.
Yeah,
He's got discharge.
and that may be a misnomer, in which case if it's not lymphedema but regular accumulation of fluid, then it's compression.
And elevation.
Yeah.
If you elevated that leg above the level of your heart and you compressed it with an ACE wrap or a support hose like 18 to 22 pound to the knee, that'll bring it down.
Absolutely.
And then your wound can heal and the drainage would stop. That's a big problem. I deal with so much of this.
Yeah, lots.
Lots of it. 75-year-old male from Pierre has been hearing loss and severe tinnitus, struggles to sleep, participate in normal conversations. Does the docs know any way to manage tinnitus?
Easy answer, no. I've had it for 30 years.
I see you have hearing aids.
And I have hearing aids, which goes along with tinnitus usually, high-frequency hearing loss.
Did you have noise exposure that did this, or is it inherited?
Both. I don't believe there's a good treatment for tinnitus. Do you know of a good treatment for tinnitus?
Turn on the radio and then turn it to off the channel and listen to the and then let that help you, or wave machines, or in other words, cover up. There's no good treatment. Nothing.
Yeah.
It's nerve loss.
Yep.
Yeah. Is there any help for people with IgG4?
I don't know enough about that to answer the question.
You know, I don't either. I would say immunodeficiency and need IG shots, you know, and I just don't know enough.
I don't either.
And here's our last question. 44-year-old female from Sioux Falls with many conditions, most autoimmune in nature. Her AMA is 1280, now presenting with Crohn's or colitis. Can the digestive issues cause all of the other autoimmune symptoms? Could lupus cause a variety of autoimmune symptoms? So she's got autoimmune in nature. I don't know what the AMA is.
That's probably anti-mitochondrial antibody, which goes along with some of the inflammatory bowel diseases and hepatitis, autoimmune hepatitis.
And the digestive issues cause all the others. I think they run together, don't they? Yeah. I mean, it's like, it's a myriad of diseases. It's sort of like a rainbow kinds of things. Could lupus be a cause? Yeah.
Yep.
Anti-nuclear antibody, ANA, and then anti-mitochondrial is related.
Yep.
Bill, I can't tell you how much I appreciate you coming all the way from Omaha. I'm going to give you twice as much money as I get for doing this. Thank you so much.
That's a deal. Thank you, Rick.
Thank you for joining us on our website. We appreciate all of your questions and the opportunities to answer them. Until next time, stay healthy out there, people.